Hello and welcome to another edition of. Wow, I totally forgot this. I am excited to host the Right Way to HSA. Usually, my coworker Mimi is here and she does the intros. As you can tell, I kind of missed out on that. But welcome to another edition of the Right Way to HSA. Today, we are very pleased to have Alaric Aloor with us, who's a founder and CEO of a company called Archon Sec, and we'll be discussing HSAs, health savings accounts, and startups. Without further ado, Alaric, do you want to quickly introduce yourself and your organization?
Yeah, hi. Good afternoon. My name is Alaric Aloor. I'm the CEO and founder of Archon Security. We're a managed security services provider based out of Indianapolis, and we've got customers around the country, some around the world, North America, Europe. We're about 20 strong, I think, totally. And we do cloud security, we do compliance, we do a lot of data governance work. We work across all verticals, really. We've got practice areas that cover DoD contractors. We have a large nonprofit practice, and we've been around since 2014. So we're coming up on 10 years here in the next year and a half or so. And I'm excited to be here.
Wow, didn't realize it's been almost a decade. That's
Oh,
awesome. Great, cool. Well, hey, as a founder leader of the company, and you mentioned about this coming up 10 years. In the last 6 to 9 months, we've dealt a lot or heard a lot about the Great Resignation. How has that impacted you guys or your peers in your industry and made you think or act differently from a benefits perspective?
so yeah, fortunately, we have not seen any of the great resignation in our organization. We've been lucky, we've been fortunate. Um, I have heard of that happening across across the board, and especially in the MSSP space. People jumping in to go for different opportunities, which they should, better opportunities. We haven't had that, but I think it's also something that we've done and we've tried to over the last 8.5 years. Um, we've had profit sharing is something that we offer our full-time staff. We also started offering benefits early in the pandemic, which I think was something that we had talked about. But as a smaller organization, it is harder to provide benefits, mostly because uh, premiums can be very expensive for not the greatest coverage. And then we managed to, after a few years of looking and working with some partners, to offer healthcare, and we're very happy to do that. And I think that has been that, along with the profit sharing, has been a big part of, I think, why we haven't seen as much attrition in our employees over the last few years.
Oh, that's awesome. And from a benefits perspective, you talked about, many smaller companies are looking to provide the benefits. However, the coverage provided is often not very complementary to the premiums that an employer, as well as employees, whenever they actually have to pay out for that. Are you doing anything, or your peers in the industry that you speak with on a regular cadence, talking about how they are looking at the current times as an opportunity to re-engage with their employees, particularly around helping them better understand what's already offered and be able to fully leverage the benefits that are being given to them this year and the coming year in 2023?
Yeah, so fundamentally, I think your healthcare should be disconnected from your employment, right? I've always believed that. I don't necessarily think that, and we've not had this, but I have had conversations with people who've had people that they wanted to bring on, employees that then took a different job, mostly because the healthcare package wasn't what they wanted or what they needed, right? Because you've got families, you've got significant others, you've got people with other needs that, when you're paying, especially in the SMB space, you've got uh, you know 20, 30 people size companies, and you can't really negotiate with healthcare with your insurance providers to get the rates that a larger organization might be able to. So for us, I don't necessarily know that if we're trying to re-engage with them, because we've just started offering that as the last couple of years. And I think what we've seen, what we weren't we were pleasantly surprised to see how many of the staff, I think it's everybody, maybe with the exception of one, who ended up uh, taking advantage of what we're offering, because we partner with a few other companies to provide those premiums that would be lower for coverage that they would not have or did not already have. So from a re-engagement perspective, open enrollment is coming up. One of the things that we're focused on is trying to increase awareness for our staff about what we have, what we offer, and how to best make use of what it is that we're offering them.
Yeah, that's a great point. And have you all kind of thought about what are one or two ways to implement, working with your HR partner or whoever is doing this work on your team, on what's best ways to actually promote and raise awareness around the benefits that are already available, whether it's around retirement or healthcare?
Yeah, so I think next month we are doing weekly sessions, and people can sign up as and when they have availability. But it's our HR partner that's going to be specifically talking about, hey, we've had this, and again, like I said, we've only had this in place coming on. It will be 2 years next month, I think. So a lot of people are still sort of getting used to it. We have an HSA offering as part of our benefits package, and that is as you know, a complex subject for people to put their minds around, wrap their minds around. So we're having these weekly sessions that people can sign up for and get this information about about how it's being done and what it is that they can do to take advantage of the offerings that we currently have. Now we might also be switching plans, I think, and I'm not very sure. We might be switching to offer some more benefits, and I'm not up to speed on exactly what it is that we're doing, but that is something that's also part of those weekly trainings that we're doing next month.
Oh, great. That's awesome. And you touched on two topics that I didn't even plan. You talked about health savings accounts and you all offer it. That's awesome. Can you share a little bit about how, as an individual, and then also as a leader of your organization, how HSAs are, what is the level of awareness around HSAs? How did you find out about it? And what are some of the things you learned during your discovery?
Okay, so I have been familiar with that HSA since I was in grad school, and when I was doing a little bit of teaching. My healthcare was provided by the university where I was doing that teaching, and they had an HSA. And that was my first time being aware of what an HSA was, and the fact that you essentially get this free money to use towards medications or like your prescription eyeglasses. And I thought it was really cool. And then I believe I still have that. I just don't know. I think you and I have talked about this in the past, where I don't know how I can roll that into something else, because as I found out over the last 2 or 3 years, conversing with you, has been that it's not just for healthcare. It can actually be used as an investment vehicle, right? And so when we started, I was actually a big proponent of us getting a healthcare plan that also had an HSA, because I knew of the benefits over time, reading about it, and the fact that it's not just this free money, but you can sort of get that money to work for you in a way and contribute, that can eventually contribute towards retirement and as you get down that road. So it's been a very long journey. I didn't know very much about it. I know a little bit more about it. I wouldn't say I know maybe less than 50% about it, but what I do know, what I found out, has been that most people's understanding of an HSA, which that number in and of itself is very low, but understanding of what that HSA is and what it can do for you is even lower than the number of people that know about HSAs. And so we have specifically over the next month asked our HR partner to specifically talk about what this is. Like, what is this thing that we have, this HSA, and what it can do for you and how you can utilize it, right? So I think from a healthcare perspective, they understand the benefits. They know that they can, you can go here, you pay this, here's your copay. All of those things are fairly clear, but we have this HSA offering. And, what is it that what is it that you're contributing? What can you use that money for? How can you use that money? How can you utilize that money? Then maybe use it as an investment vehicle. So those are some of the things that, those are some of the conversations that are going to be happening over the next month.
That's good to hear. That's music to my ears. And yeah, we can absolutely help you with the rollover. So that's not a challenge there. We can
Yep.
help you find it and then roll over. Um, in all of the findings around HSAs, what did you think was one of the biggest surprises about health savings accounts that you're like, oh, that's something I had no idea?
Honestly, it was the fact that my genuinely my understanding of an HSA was here's this pot that gets filled up with money, and you have X amount of time to use it, or then it just. I think sometimes it rolls over and sometimes it doesn't. I don't really know the minutiae of it, but if you don't use it, then it's gone. But it takes a while for that pot to get to where you can use it. But the fact that it can be used, and this is obviously after having had conversations with you, that it can be used as a financial vehicle, that I think has been the biggest surprise to me, because that was not because uh, till we started talking about what Savings Oak is doing, my understanding of HSAs was it was purely health related, right?
Yeah.
It just is, and you can use it for this. But the fact that you can then make your money work for you is something that I think has been the biggest surprise. In fact, when I mentioned that 2 years ago, when we were when we were getting started on our offering health insurance to our staff, that was, I think, also and I couldn't obviously advocate enough for it, and not speak about it because that's not my area of expertise. But I insisted on it, and I think that is one of the things that the majority of our staff that are hearing about this, are going to hear about this next month, are pretty excited about, because I think their understanding of it is where I was about 10 years ago.
Wow, that's music to my ears. Just one bit of clarification there. HSAs, you never lose the money; it is always yours. We always talk about the fact that that must be the biggest myth about HSAs, because people confuse health savings account with flexible spending account,
There we
and
go.
this, yeah. So there's the S is very important there. One is about savings, the other is about spending. So you never lose your HSA dollars ever. Once they are yours, you can invest or leverage it to your advantage. One other question that comes to mind is, as you think about where we're headed in 2023, you're talking to a lot of SMBs on your own. What are you hearing from your peers, particularly in the C-suite, about some of their challenges around benefits, or specifically even more around healthcare, rising healthcare costs?
Okay, so this is interesting. I was just at a conference a few weeks ago, where this came up, right? And in that SMB space, um, I think one out of every two Americans is employed in a small to mid-sized business,
Correct.
if I'm not wrong. And I think that's 2019 or 2020 numbers, right? So I'm guessing it's still right around there. But I think what's really interesting, and when I talk to customers or when I talk to peers, it's this inability to be able to offer healthcare that actually covers what it is that they would like, to be covered for their employees. And it's still very hard to get to. There's a lot of research that has to go in, and by research I mean just trying to find the right partner to be able to help your small organization get to a point where you can actually offer benefits that can be considered benefits, right? Otherwise, what it ends up happening for the most part, and a lot of people that I've talked with over the last, and we started 3 years ago on this journey, and was that they had employees that were paying like hundreds of dollars a month in premiums, and then finding that when they actually went to go to the hospital, to go to the doctor, a lot of that wasn't covered by the premium. So it was like, you say you have healthcare for the sake of saying that you have healthcare, but it really doesn't cover literally anything, right? And so I think that I think still remains a very, very big challenge. When you're in a large organization, it's a lot easier because you have the ability to then negotiate with insurance providers, right? As a small organization, unless you find similarly aligned organizations that are willing or looking to provide those benefits to their employees. And again, as small organizations, you don't necessarily have to. So I think I think going back to your question about the Great Resignation, I think there's a significant value add in smaller organizations providing benefits healthcare and others to their staff to avoid attrition, right? And because it's not, you can't just say this is your base salary, this is what it's going to be, and that's it, and then expect people. You've got to provide an environment that people can, employees can flourish in, and that also, that they're not always worried about, hey, I might have this health scare come up, but I don't have anything. How am I going to pay for this out of pocket? And I think that remains like a really, really big challenge in the SMB space, that it's not easy to find.
Yeah, that's a great point. And on that note, how do you personally think about retirement now that you figured out, hey, HSA dollars can be complementary to the 401k plans? How are you personally looking at it, or what has changed since your realization of HSA money can be invested and complementary to 401ks?
Yeah. So, on a personal level, I just found that out a few years ago, thanks to you. So, it's one of those things where I think once we get past November and we get some more information about this, these new, I use new in quotes because it's going to be the same, but we're adding some things on. One of the things that I'm really interested in finding out is how can we make this work as an actual investment vehicle, right? How can we make these dollars, which now I just found out that they also, you don't lose them. So that makes me happy because I know I have an HSA account that I need to find where it is, what dollars are in there. And that's been since 2006, I believe, is when that started. So we're almost, 16 years in. So I would like to know, hey, what is it can I do with this money? What can I do with this money? What are my options? So I think I'm pretty excited to learn about this, and then maybe talk a little bit more to my team about how, this is why I insist on us having this, without being fully aware of how it can be used. But hey, we now know somebody that can help us invest this money that we're putting away.
Yeah. No, happy to. And certainly at the current inflation rates, any money that you have that's sitting there in cash is actually losing its value if it's
Yes,
not invested. And I'm
exactly.
assuming it probably isn't at this point in time. Um, yeah. So if you go back in time, and what's your advice to your younger self, or anyone starting, early career, looking at not thinking about retirement right now because it's 30 years, 40 years later? What would you suggest to them?
Um, Start putting some money away as soon as you can, because the faster you start, the better off you are. And it doesn't have to be, a ton. If you have an employer that matches, take advantage of that, right? Because that's good. Your take home might be a little less than what you might want, but you're all, putting money away for a rainy day is always, it's an axiom that I think has stood the test of time because it really does matter. So, yeah, do put as much away as you can, and your older self will thank you when you're older. Look back on your younger self and thank your younger self. But yeah, it's I did that, right. But it's also, I think, financial awareness and education isn't something that we focus on in this country, right? So either you have to have parents that teach you this, or you have to have some peers that say, "Hey, do this." So, honestly, I would say, like, get financially aware and educated about what it is that you have, what it is, and where you would like to be. So, when you're 25, it's probably really hard to imagine that you're going to be 60 at some point, which we all do. But think about that. So, thinking about it from a holistic view of, hey, this is the kind of lifestyle that I would like to lead when I'm this age, and this is what I have to do to get to that point. Castles and empires aren't built in a day. It takes time. It takes brick by brick. So that's what I would say. Think
Well,
about that.
it's a great advice. Well, I'd be remiss if I didn't ask about the beautiful car like art behind you for all the audience members who are interested in racing and stuff like that. Can you talk a little bit about your personal interest in this, and also what are we looking at behind you?
Okay, so I'm a big Formula One fan, right? And on Twitter, on race Sundays, that's usually all I'm tweeting about. So, and right behind me, uh, is a sketch figure of an Indy 500 car. So I'm based in Indianapolis, which is where the 500 is held, and that's where it is. So it's 3 different car models that are here, and I don't know if you can see all of it, but that's what's right behind me. So I love
Awesome.
racing. It's one of my favorite sports to watch, and I'm lucky that I have this as my background today.
That's great. Cool. Well, we really appreciate your time, and thank you for coming to the Right Way to HSA and sharing with us. We appreciate it. And for our viewers, we'll be back again next week at noon Pacific with another edition of the Right Way to HSA with my co-host Mimi Mortazai, and we'll share what's going on with retirement and health savings accounts from another user's perspective. Thank you so much for joining. Have a great rest of the afternoon or your day.